Your Teneo Treatment Center offers you many different ways that you can position patients. First off, when you look at the armrest, on the back of it, you'll see a rectangular white button. This allows you to get patients in and out by putting the armrest into two different positions. That's one of them, and the second one is fully open. Once the patient sits down, you can swing that all the way back. When you go to start your treatment, you can step on the foot pedal and bring the delivery unit all the way back to you. Once the delivery unit's in position, you now have access to all your different controls for patient positioning. The top row of buttons in the extended mode has the ability to control the headrest height up and down. You have the headrest articulation, forward and back, and then you have S, 0, 1, and 2 for your saved preset positions. S is a sit-up position. 0 is patient in and out, so you'll use that in the beginning and end of your procedures. 1 and 2 are upper and lower jaw. I'm going to go ahead and push position 1, and that will bring the chair back into a treatment position. When the chair reaches its treatment position, you can then fine-tune using these buttons over here on the right. The first set of buttons is called ergo motion. You notice when I use these, the backrest and the seat movement are synchronized together. If I use ortho motion, the lower group of buttons here, that will tip the entire treatment center without moving the back and seat separately. Finally, on my lower row here, I have the height of the treatment center up and down. If I want to change my presets at any time, I can find as close as possible to the treatment position that I like, and then I can trim it to the exact specification that I want. So maybe I want this a little bit lower, and then I press and hold position 1. That automatically saves for the future my number 1 treatment position. There's another way that you can move the treatment center, and that's using the foot control. I can use my right circle here, and that will bring the delivery unit and the patient in and out, or I can also activate the S position using the left circle. In addition to the foot control, I also have the foot control joystick down here. You can program this to move the headrest, articulation, or the backrest up and down. And if I pull this switch up and down, then I can move the entire treatment center in that direction. Finally, I have the controls on the back of the headrest. There's 2 blue knobs that you can control all of the same functions I showed you on the touch screen. The top one controls the headrest height, and the bottom one, side to side and up and down, control the height and the backrest. And that's the different ways that you can position patients utilizing your Teneo Treatment Center.